Dr. Charles Shaw. I'm Director of Lincolnshire Youth Association, but I'm also Chair of the Centre for Reconciliation. And I'd like to welcome those of you who are online now, to what we hope is going to be the second of our really interesting sessions, moving forward our work in National Interfaith Week, in order that we can all come together and share what we've got as our knowledge and feelings and experiences at this time that work towards the objectives of the Centre for Reconciliation, which of course is encompassed in the word. And we have to be clear that that's around peace and reconciliation and a coming together. I just want to commend this piece of work that the Centre's doing, and which Subhash, as director of it, is doing. And we've got another session tomorrow night where people can debate even more. But I think rather than me going on at length, it's now for me to hand over to Abdul, who will introduce tonight's presenter, contributor, speaker, enlightener.
All right.
Welcome, everybody.
Thanks, Charles. Thank you very much. So we have got a very close agenda, and first of all, thanks everyone for arranging this very interesting workshop. And I'm fortunate enough to introduce the speaker. And I think our speaker is they don't need any fame. I think in Lincoln people knows about them. I'm talking about the Nightlight Crisis Cafe project, where this is one of the projects which was born in a partnership with NHS and the Church of Lincoln by ACT Trust, and we have a very special guest who basically behind the scene running this project, and maybe people wondering around what is that Night Cafe Club is just basically is the aim of this cafe is to support people experiencing crisis and hope to reduce suicidal cases and offer hope and support. It's non-clinical support basically. I would say. So any kind of people are going through with a lot of mental support, mental issues. Especially the student, I've noticed, I've met a lot of students during this COVID-19 situation, and they're really suffering. There are many cases where they are unable to work, they can't afford fees, and there are many issues where I was wondering where I can redirect. So now I've got got to know that Stacey, who's our guest today, and she is really running very special project around that. And without taking too much time, I would like to welcome Stacey Marriott to come on board and basically give us insight of this project and make a most of that of this project. So welcome, Stacey. I will hand it over to you.
Thanks, Abdul, and thank you for inviting me to join you this evening, everyone. It's really nice to be here. So as Abdul said, my name's Stacey Marriott, and I work for a local charity called ACT Trust. And the motive of ACT Trust is to empower people to end poverty. And ACT Trust sees poverty as affecting people in 4 different ways. So breakdown of relationship between man and God, between man and the world, between man and each other, and also between man and himself. So ACT Trust is there to empower people to end all those different kinds of poverty. So I just want to tell you how I came to this place of working for ACT Trust. So a little bit about myself. I grew up here in Lincoln, and when I left school, I didn't know what I wanted to do with my life. And so I decided not to go to university straight away. I thought I'd have a gap year. And then at the end of that gap year, I still didn't know what I wanted to do with my life. So I thought I'd have another gap year. And that carried on for 4 years. So I had 4 gap years, and I still didn't end up going to university because I still hadn't figured out what I wanted to do with my life. But I'm pleased to say that now I feel I have found that after all these years. But as one of those gap years, I did an internship in New York in 2001. And I'd only been there for a few weeks when 9/11 struck. And that really impacted my life. And a year later, I got very unwell myself mentally. And so I just want to tell you this because I want to let you know that I myself have experienced mental health crisis. And that is part of where my passion for this project comes from, that we're talking about tonight. So a few years ago, I got a job working for a live church as a community worker. And I had this overwhelming feeling that there was some gaps in the community in professional provision for people in mental health crisis. And it caused me to wonder what we could do to fill those gaps. And so I thought about this and I prayed about this. I knew people out in the community and also in my church who were in a crisis with their mental health, and they felt let down by the system because the waiting lists were so long and because the professional people just didn't have enough hours in the day to meet all those needs of all the people that needed help. So there were these big gaps, and I started to pray about what the solution might be, how we could stand in that gap. And also at the same time as praying, I started to research what other cities had done to fulfill this need in their communities. So I started to ask Google, as I like to do. And I found out about these crisis cafes that had been set up in Leeds. About 4 years ago, they started to develop these crisis cafes, which were cafes that are open at night time as an out-of-hours service. So rather than people going up to A&E if they found themselves in crisis or calling 111 or 999, they would have a safe place to go to where they'd be welcomed and cared for during that time of crisis. I thought that was a wonderful idea. And I wondered if that's what Lincoln could be lacking. And I thought maybe we as churches in Lincoln could make this happen. And around this time, I spoke to a lady that I knew who happened to know the head of the crisis team. So she offered to connect me with this lady who headed up Lincoln crisis team. And I went up to PHC for a meeting with her. And I told her about this idea to have crisis cafes in churches around Lincoln. And her response was, what a brilliant idea. That's fantastic. Let me know when you're up and running. So I left PHC that day thinking, well, I knew it was a good idea. And this lady's just confirmed from a professional point of view that it's a good idea. But how on earth do we make it happen? I just felt a little overwhelmed. I just didn't know what to do. But around that time, I'd heard about Greater Lincoln Active Faith Network, which you might or might not be aware of. So just to give you a bit of background about what this network is. So a few years ago, the Cinnamon Network did a faith audit, which I found a copy of this earlier. They did an audit of faith action in Lincoln, of all the different faith groups and what they're doing. And they found that each church or faith group was delivering, on average per year, 8 social action projects, support for 1,500 beneficiaries, with 6 paid staff, 117 volunteers, 6,602 paid staff hours, 34,386 volunteer hours, which equaled to £342,858 worth of support if you work out for the living wage for each of those volunteer hours. So that was a huge resource that the local community was having from all the different faith groups serving the local community, which was saving the local authorities a lot of money. So after this audit had been done, some church leaders met with Rick Metcalf from Lincoln Council, and all this was presented to him. And his suggestion was, he said that as the Lincoln Council, they knew that faith groups were doing all these wonderful things, but there was no joined up thinking. People just were doing their own thing in their own corner of Lincoln. People weren't working together, they weren't networking, and there was no one central place where the professional agencies could communicate with the faith groups. And so as a result of this, the Active Faith Network was set up as a network of churches across Lincoln, and to create people working together and to create that central point where the local authorities could communicate with the local churches. And part of the Active Faith Network strategy was to divide up into 6 different subgroups, each group addressing a need of Lincoln. So those 6 subgroups are inclusion, food poverty, finance, homelessness, youth and children, and health and well-being. So people were invited to join these subgroups to work together to address the needs of Lincoln. And I went along to the health and well-being group as it was launched. And that very first night, I mentioned this idea about the crisis cafes, and it turned out that several other people in the room had also been exploring this idea of starting mental health cafes in Lincoln. So we started that conversation, and we met every few months and continued the conversation. And we invited people from the NHS to come and talk to us about how we could make this dream a reality. Then last year, every year there was a civic prayer breakfast for the last 3 years, where civic leaders were invited to join with church leaders in Lincoln Cathedral to eat breakfast together and to talk about the needs of Lincoln and to pray together and to encourage each other. And at last year's civic prayer breakfast, one of the commissioners from the NHS actually approached the head of the Active Faith Network and said, if we can get funding for this, will the churches of Lincoln make this happen? Will they make these crisis cafes a reality? And the answer was yes. We really felt this was something we'd been called to do. And we really believe that through all this hard work of building bridges and working together, that through that unity, this was fruit coming from that. And so it took a few months for the funding to be put in place. And that funding, the model was to have 7 different churches, each open on a different night of the week, committing to running the cafe that night of the week, so that all year round we'd be open every single night of the year. And so the funding was to cover that, and also to cover the role of a coordinator to oversee the project and to make it all happen. I was asked if I'd be interested in applying for the job, and in December last year I was appointed, and I started in January. So the health and wellbeing group, we put these lines together that we wanted to provide places of peace and safe spaces for people experiencing a crisis in their mental health. That was what we're setting out to do as a non-clinical, out-of-hours alternative. I think many of us will have safe spaces. That might be the homes of family members who we can go and visit, and perhaps our parents, perhaps close friends. Many people have those kind of safe spaces, but some people don't. And looking back in my own life, there's a few memories that really stand out to me of when I've had that gift of finding a safe space when I've been in need. And so I remember one time when I was experiencing a crisis in my mental health, and I was in a really low place. I didn't really have a support network around me, and I went into a pub. I had no money. It was on an afternoon. I went into a pub and I had a tea bag in my handbag, and I approached the barman and said, I've got no money, but I'd like a cup of tea. I've got my own tea bag. Can you give me some hot water? And I've got no friends, so can you be my friend as well? I was in a really low place. Unfortunately, that barman was a really kind man, and he must have recognised that I was really struggling. And he pulled up a bar stool. He gave me a mug of boiling water to put my tea bag in, and he just had a friendly chat with me. He didn't judge me. He showed me acceptance and had a friendly chat. And I went away feeling a little better that day. And another example from my own life, I don't know if any of you have ever been to Curry Jack's, which is a curry van that in normal times, it does come to the university quite regularly, I think. And they do delicious takeaway curries. And I went there a few times, and I soon came to know that the people at Curry Jack's, Derek and Fiona, were really lovely people, really welcoming, really kind people. And they made me feel accepted and welcomed and not judged. And so if I was having a bad day, I would go there. I didn't necessarily want a curry, but just for the chat. These people made me feel better. I would go away. I wouldn't have had all my problems solved, but I'd felt accepted and listened to and cared for. And so this is the dream with the crisis cafes. This is what we want to create. Places where people can feel completely accepted as they are, not judged, where a listening ear can be offered, a hot cup of tea, and people will go away feeling a little better. Or a lot better, would be great. So that's what we're aiming for. So in January, we started off by writing round letters to all the local churches and asking them if they were interested in getting involved, if they could let us know. And we had 7 different churches responded. Some of them had more than one building. And some people said they had lots of people within their church family who would like to volunteer. Other churches said they had elderly congregations and they didn't have anyone in their congregation who was able to volunteer, but they had buildings they could offer. So very quickly, we were in a position where we had 7 different venues to run these cafes from. So we also started to recruit volunteers. So we had, as I mentioned, some people that came from the local churches, and we also, we had an article in the Lincolnite. We had a huge response from that. So we had about 50 people applied to volunteer as a result of the Lincolnite article. So we started to build this team of volunteers, and they started to undergo training in mental health first aid and safeguarding, listening skills, suicide awareness, and more training. And then in March, we were in a position where we were able to open our first 2 cafes. But as we all know, this year hasn't turned out quite the way we expected it to. So after 2 weeks of the cafes being open, lockdown was announced and we had to close them again. This was really disappointing, but we felt that we didn't want to just sit back and do nothing throughout lockdown. We had all these volunteers trained and ready for action. And so we started a remote support service with backing from our partners in the NHS. So we started to host Zoom cafes where people could join and have conversation and connection safely from their own home. We also offered phone support where people could receive regular phone calls from our team of volunteers. And since the start of lockdown number 1, over 400 phone calls have been made to people in crisis in the Lincoln area. And we've had situations where someone may have received a call and disclosed that they had taken an overdose. So in that situation, an ambulance was called and there was an intervention there to save someone's life. And we had other people who gave feedback that we might be the only people they spoke to all week, and it gave them one thing to look forward to. So they were so isolated during lockdown, they're just not able to speak to anybody else. So it really helped a great number of people. And we received referrals from a number of different agencies. We'd been building relationship with the police force and the ambulance service, the social prescribing team, the crisis team, many other professional agencies, and they referred people to receive this support. People were also able to refer themselves through our Facebook page and through our phone number. Then in July, we were able to reopen 4 of the cafes that had been ready to open back in March. And since July, we've had 63 attendances to the crisis cafes. Some people we might only see once or twice. Other people are coming weekly to receive support whilst they wait to see professionals. They might be on a waiting list to see a psychiatrist or a psychologist, and they want some support in the meantime while they wait for that professional support. So we'll see them more regularly. Crisis looks very different to different people. So we have some people that are in great despair and other people that are in lower level crisis, but they're still really benefiting from the support. So over the next few weeks, we'll be ready to open the final 3 cafes. And so by the end of 2020, we'll have achieved what we set out to do, which is to be open 7 nights a week, every night of the year. I've come to realise that as individuals, we can't be there for everybody all of the time. We can't be there for all the people all of the time, because that would affect our own mental health and we'd just burn out. There's no way that any one person can be there for everybody. But collectively, we can be there for more people. If we work together as different faith groups and different organisations, we can have a great impact on the local community. We can really stand in that gap. We can have a great impact on a lot of people's lives as we serve the local community together. Thank you.